It's 6:29 on your Thursday, and lung cancer is the second most common cancer in the nation, and Carle Health in Pekin is offering free lung cancer screenings to help make sure you know what's going on in your body. And Heather Franklin, an oncology nurse practitioner with Carle Health, is here to tell us more. So first of all, thank you so much for being here this morning.
Thank you for having me.
Of course, a really important topic to discuss. So why should people get lung cancer screenings in the first place?
Our whole goal is to have people get diagnosed early. We want them to get scanned before they start having symptoms. Early diagnosis means that they have more opportunities and pathways for treatment.
So is there a specific group of people that should be getting screened, or a certain age you reach that you should start getting screened?
I recommend that anybody over the age of 50 who has, currently smoking or previous smoking history, reach out to their provider and ask if they qualify for this screening or this test. And they can always visit the Carle website and call our clinic to see if they do qualify for that screening, and we're happy to take care of them.
So some people are, worried about getting screening because they don't exactly understand the process of it. So what goes into it, and how do people know that there's nothing to be afraid about?
So what's involved is a low-dose CT scan. It takes less than 10 minutes. So that's, it's short, and then the next best part is that there's no poking, IVs required, so it's quick and painless.
Fantastic. A super quick turnaround, and then probably able to find out your results pretty quickly.
Absolutely.
All right, so why should you not get one, right? So tell us about Carle Health's upcoming free cancer screening day that's coming up.
The free cancer screening day is happening on the 20th, which I believe is next Tuesday, and it is going on from 8 a.m. till 2 p.m. We are serving a wide range of scanning and testing, including skin, lung, breast, cervical, and ovarian. And just come down. If you have any questions, you're not required to get tested. Just come chat with us. We're happy to answer questions. And again, it's free, so come on by.
Right, perfect opportunity to do so. So what are some of those things that might show up that you should be concerned about, or maybe not concerned about, that could also show up on those scans?
On lung cancer screening, obviously, we're trying to look for nodules that could be abnormal. There are some nodules that can pop up that may not be cancer, but need followed up in the future. So that's why it's important to get your scans and to follow up with your doctor.
Most definitely. So you also, your role and the suspicion of cancer clinic is, it's huge. There are a lot of people, again, like I said, that don't want to go to the doctor or are worried about it. So what is your role in, making sure that everybody is healthy and whatnot?
Well, our team actually kind of is, I see it as like the buddy system. So when you get a cancer diagnosis, it's a big deal, and there's a lot thrown at a person. And so we kind of help them through the whole process, not only, identifying and letting patients know, hey, this could be cancer, but going through the process, okay, this is cancer, now what? Who are we going to go see? We're going to see all these specialists. What's the next best step in treatment and trying to attack this thing? And so we help them through that. Plus, we have social workers, dietary assistants, and we follow you through at least 2 years after treatment.
So if nothing ends up coming up on those scans, how often then after that should you be getting more screenings?
Well, if you meet the requirements and, again, check with your provider, they can get that yearly.
Okay, and how does it feel just knowing that you are able to figure out somebody's path with their health, being able to be a part of that step?
Oh, I love it. I've been a part of the system and worked at the hospital for almost 20 years, so I've been in different areas, but I love helping patients, and, through tough times, good times, and on their way to recovery is the best part.
I can imagine.
Yeah.
So, okay, one more time really quickly before we go, the when, the where, how people can get their free screenings.
Next week on the 20th from 8 a.m. to 2 p.m., lung cancer screenings, a wide array, lung, skin, breast, cervical. Come on by. If there's any questions, just stop by and chat with us.
Perfect. All right, well, Heather, thank you so much for being here this morning.
Thank you.
Of course. And all those details were on your screen, but they will be shared on our website, ciproud.com. And all you have to do is click on the WMBD This Morning tab under News.